Hello viewers, welcome to my YouTube channel and please don't forget to subscribe. All viewers, after listening, please subscribe to my channel. My name is Sister Dr. Juliet Wangui Macharia. I am a gynecologist and a fertility educator and medical management doctor, and I belong to the congregation of Sisters of St. Joseph of Mombasa. And currently I'm based in Voi, Taita Taveta County. Today we are going to talk about infertility. Infertility has become a global issue. 17.5% of individuals suffer this in their lifetime. It is actually a lifetime prevalence after many researches has been done. And 1 out of every 6 persons globally suffer from this condition. In Africa, a fertility rate is high, but we have a number of people, and especially at this particular era, who are suffering silently with this condition. Some have what we call primary infertility. This means this woman has never conceived in her lifetime. She has never miscarried, no pregnancy at all. Then we have what we call secondary infertility. So secondary infertility, this is an individual, a lady who has already conceived, but now she's looking maybe for a second baby or a third one, but she's not able to get it. So infertility is defined as inability to conceive within the 12 months in any woman who has had regular intercourse. So this woman, for all these months, or even more than that, has been having regular sexual intercourse with her husband, but she has not conceived at all. So this is what we term as infertility. But we have some women who may also come to us, somebody who had no issue of infertility, but after 6 months, she has been trying to conceive for more than 6 months. So when she comes to you, because this is a lady who may present with secondary infertility, as a fertility educator and medical management, we are supposed to manage this client. We should not let her go back and wait for 12 months so that we can define infertility. So many people, as we are talking now, are suffering from this condition. And some have undergone very expensive investigations. Some have undergone even invasive investigations. They have visited several clinics without knowing actually what they are undergoing, or even coming with a diagnosis of what could have led to this condition that she has, or the factors that has led to this. So they kind of get exhausted, and some lose hope. Some get discouraged. Some no longer now live as married people. They have divorced, or they have decided now, let me look for another partner because of this condition, infertility. So these are long road for many women in this planet, especially in Africa. When we talk of infertility, it is normally directed to one side, and that is female factor. And we have many women who have suffered from this because of the stigma that they have received from the community that they are the problem. But always remember, infertility is not one-sided. We have a female factor, yes, and we also have a male factor. And as we are talking now, research has shown that the male factor is actually, the number are actually increasing. And we have a number of women who present to us, and after doing investigation, we find that this woman is okay, but the husband is the problem. But because of that, it's kind of a myth, but this is a woman factor. Males, they do not like coming to the hospital to be investigated, because they believe behind their back that this woman is the problem. I am not the problem. But let us all know, infertility, it is not one-sided thing. It is, if they are married, both of them, we need both of them to be investigated, to be examined actually, and then we come up with the right diagnosis. So we find that many women endure a lot of pain, a lot of surgeries being done, a lot of doctor's appointments, you see, but they all end up with the dead ends. There is no kind of solution to the problem. So FEM, this is Fertility Education and Medical Management, which is an organization, and the majority of us are doing research or have based our scientific facts with the research that has been done. And this is what we want people to know, that as much as infertility is a problem, but the solution of this problem is actually, that's what we are saying, it is actually, the answers are actually hidden inside the menstrual patterns. And I being one of them, after doing a research for a year, I came to find that most of the problem that women may present, because my participants were women, so a woman may present to us with this condition, but actually when you get to understand her menstrual patterns, her bleeding patterns, her cycle length, is she ovulating or she's not ovulating, then doing some what you call basic hormonal profile, most of these women, as I'm talking now, majority of them are breastfeeding. And it was just like a joke, because how can one suffer for infertility for 9 years, 10 years, 16 years, and then applying what FEM teaches us? This woman, within a period of 3 months, 4 months, 6 months, she's pregnant. Because FEM normally dig the underlying cause. It is not doing the HCG. It is not doing the abdominal scan only. That is not enough. It is not giving the FEMI plan to women who have excessive bleeding. It is more than that. Understanding the science behind the patterns of the patient before you has helped us to know the underlying, the root cause of women with infertility. So I always say that FEM has a solution, and FEM is real because we have seen it working. And this is what we want this education to reach many people. Let them understand that most women who present to us, or most of these men who present to us with infertility, majority of them are not infertile. They have what we call, there is an obstacle that is making them not to be able to conceive. Some are manageable with very simple drugs. Other than doing a lot of investigations, a lot of hormonal profile, a lot of invasive examinations and all this. So we have hope. FEM is bringing hope to these women. FEM is bringing hope to these clients who have been suffering from this condition. So, why do people suffer from infertility? Let's take, for example, a lady. This is a lady who, after gaining her menarche, she was back in her 13 years old or 12 years old. But since menarche, she has been having issues with her menstrual cycle. She has excessive bleeding. She's missing this menstruation. This is the patient who comes to us when she is 28 years now old. When you talk of 28, maybe she had her menarche at 13 years, and now she's 28. So we are talking of 15 years of suffering, not understanding that her menstrual cycle has issues. So these are women, when they were in the adolescent, they used to miss menses. These are kind of women, some may have ovulated. They used to see the cervical mucus we have talked about in the previous session. These are women who, some of them present with very, very painful menstruation, very heavy bleeding, no ovulation, no libido. They are always not happy. This is a woman, just giving a smile is a problem. We have women with the polycystic ovarian syndrome. Their ovaries are surrounded, inside there is some water, and they have several follicles. So these are kind of women in their teen life. They had issues, but it was not managed. And because it was not managed, then she's already married. Now she wants to conceive. But the problem is all the way 15 years back. So she comes to us, majority of our clients, we will ask them to go and check the tubes. And then she brings the results back. The tubes, both tubes are patent. They are all normal. Then we ask for a scan. This woman does not have any fibroid. She's very okay. Then we tell her, you are okay. Just go and continue waiting. You will one day conceive. Not looking back at the menstrual cycle patterns since she regained her menarche. Understanding the menstrual pattern you are going to get, understanding the history behind these patterns, you shall pick a problem. So if she is ovulating, you have picked that she's ovulating, and she tells you she has a clear mucus, you look at her cycle length is normal, you look at her menstrual bleeding is normal, then you find the history, your history is okay. Then move on. You find the tubes are patent. Okay, what else? What else? Everything is normal with this woman. But this woman before you look at her, she's extremely obese. She's obesity class 1 or 2 or even 3. So we shall go deep about this later as we are trying to understand all this about the infertility. How do insulin affect the brain? How do insulin affect the uterus? Such that this woman, despite being a bit normal before you, but we have not checked her sugars. So we tell her to go home without even understanding the way she looks like. This woman will not conceive if she doesn't know her BMI. So, as we are approaching the issues about infertility, my people, infertility is very complicated. And unless we treat the patient as whole, the number of women termed to be infertile will continue to increase. And yet these women are not infertile. It is just a small condition which we need just to, we just need to make it right, and the things will work on well. So, as I had said earlier, ovulation is a sign of health. During my research, I had around 230 patients, and 192 of my clients were not ovulating. But this patient will come to you and tell you that, oh, I normally ovulate. Oh, I have some cervical mucus. Sister, I'm okay. I tell her, okay. After doing the investigations, then we will know if you are really ovulating or you are not ovulating. And to our surprise, most of women claim to be having cervical mucus, and yet this is not the real cervical mucus that we want. Yes, it may be a bit moist, but it is not stretchy. It may be present. Even some will tell you, I normally have mucus even during my menstruation. Sister, I see mucus when I'm menstruating. There is some mucus. Then, yes, the mucus are there. But the way the hormones have arranged themselves to produce this, they are somehow confused in one way or another. So they may be producing this, but not the right time for them. So women with the high follicle stimulating hormone, just even before the menstruation starts, while we need this hormone to start when this, so it is extremely high. So they will produce this mucus. But is it the right time if she has the normal cycle length? Some women will come to you, they are very okay, but their cycles are too short. They bleed after every 3 weeks, or even 2 weeks. So it is less than 24 hours, 24 days. And she claims to be okay. These are women that they will come to our offices, they will come to our hospitals. And if you don't go back and get the history, because infertility causes are either hormonal or structural. So if they are structural, then we are talking of issues pertaining the organs that take place during that are concerned with the reproductive system. So she may have very tiny uterus, or she may have some cervical issues. She may have a tumor, a cervical mass, or she may have undergone some surgery of her cervix, or she may have what you call cervical stenosis, such that the sperms cannot go through, so she cannot conceive. Or she may have what majority of women have now, what we call tubal blockage. The tubes have been blocked bilaterally. But if one tube has been blocked and the other one is patent, this woman is able to become pregnant. Because even research has shown that women can conceive with only one tube. But before we allow you as femme doctors to conceive with one tube, we have to manage you first. We will not allow you to become pregnant first until we manage you. So this is key, and this is very, very important to any woman in this planet. Women need to understand more of what they are undergoing through. They need to understand the issues pertaining all this. We have the male factor. When we talk of the male factor, now it has become a very big issue because the data are there showing that the numbers are increasing. But because men do not want to go to the hospital, men are very reluctant when it comes to this issue, then we are also missing a lot of information or a lot of managing this men. We have a number of men with erectile dysfunction as we are talking now. We have a number of male who have abnormal sperms. The sperms, when you do the sperm analysis, the sperms are not okay. Normally, once the ejaculation has been done, we need the sperm to move forward. They move forward to the uterus, rushing through the fallopian tubes to the to the ova, which has already been released during ovulation. But if this woman is not ovulating, the sperms will go. If she's not ovulating, this woman is missing a very important, the cervical mucus, which we had said, we discussed earlier. The cervical mucus is very important for the transport of these sperms. But the male himself can release some sperms, but these sperms do not know how to move. They have a sluggish movement. They are confused. They don't know how to move. It has to be a forward movement. So these are issues that we need to, this male can also present with the hormonal issues. We all know from the research have shown that if one is obese, obesity normally lowers the testosterone levels. So a man comes and you find maybe he's obese, then you have to think, apart from managing this, then there must be a problem with this guy. So there's so much we are going to learn when it comes to infertility, and people need to understand. As you continue listening and following me in my channel, my YouTube channel, please don't forget to subscribe. And my a message of hope as I end this session is that infertility is manageable, and no woman, no man in this planet should die of infertility. FEM, fertility education and medical management, is trying as much as we can to help these people who are termed as infertile, and now the solution is there. They are able to conceive. Let us continue learning more about infertility. You may not understand the pain of infertility unless you suffer from it. And most couples, even as an individual, they sometimes feel stigmatized because of this condition. So it's actually a big, big problem as we are talking now. But do you know that just changing your lifestyle, having proper investigation, examination, and coming up with the right diagnosis of what your patient is suffering from has brought a lot of happiness to these people. You can have time and check. There is a paper which I wrote about from heartache to happiness. Couples who have suffered infertility for 6 years. But to our surprise, after knowing the underlying cause of this problem, of her problem, because it was a woman factor, we were able to manage this lady, and within 4 months, she conceived. And she was so happy that she even asked us, please let people know what you have done to me. And that's why I decided to write this paper. You may read it on your own. From heartache to happiness. She had lost hope. She had taken a lot of medication, a lot of investigation. She had lost a lot of money because she really wanted a child. And she could not understand why she was suffering from this. So she lost hope. But when she heard about FEM, she came to us. And after looking at this lady, as you're going to read the paper and get to know more about it, we got the underlying cause of this problem. We managed her, we gave her hope, we journeyed with her, and within 4 months she came back, she's pregnant. And after learning that she's pregnant, we started another journey to make sure that she conceived, to make sure that she carries this pregnancy to term. I am so happy because at least the knowledge of fertility education and medical management has brought a lot of hope to many people who had lost hope, and especially those who are suffering from infertility. So, what are the causes or what are the risk factors of infertility? One, as I said earlier, it may be structural, but again, it may be hormonal. But as women come to us, we do what we call head-to-toe examination. And we have found that most women do not understand, but they what is happening. So the skin changes in their bodies can tell you something. And if you find a woman losing hair, the hair just comes out. You find this lady is not able to put her on earrings. She cannot put any. The moment she put, there's a lot of itching. She had to remove them. You find this lady maybe has issues to do with her face. She has so many acne around. The skin is so rough, such that it is full of pimples. And wherever she has gone to the dermatologist, they have given her different kind of medication, creams, and all that, but nothing. Those chronic acnes remain. Sometimes they may present, they are very, very tiny, making her face look very, very rough. This is a woman, sometimes they can present with very rough skin. Despite the creams that they are using, her skin is always rough and dry. We have women coming to us with what you call hirsutism. She has hair. She has hair. So some may present with hair on the upper limb, you see, it's all over here. Yeah. Some, they have hair around the chest. Some below the umbilicus. Some at the lower limb. They're like men. Some, they have it. Yeah? They have the beard. It may not be that much, but they have some hair around here. Some, they have what we call galactorrhea. They are not actually breastfeeding, but the milk is coming out. Some have central obesity. When we have to check around the width of her abdomen, wow, you may think that she's pregnant. Some with twin pregnancies, which are not there. Some with a single tone, but it is around that 6 weeks. But she's not pregnant. It is just full of fat. Then now you ask yourself, how are we going to manage this patient? FEM has the solution. Please don't forget to subscribe and follow me in my next channel, and we shall be talking more about the causes, the deeper causes of infertility that people may not understand. Please don't forget to subscribe and tune in my channel. You can also check my previous channels and sessions, and get to understand, because it's a flow. Remember my slogan: a woman who does not ovulate is not healthy. Are you ovulating? God bless you, and continue listening to my channel.